In the past, the private and public healthcare sectors have been cautious about working together. But NHS reforms offer a unique climate for the two to build partnerships. One company helping this to happen is Visions4Health, an independent company which acts as an interpreter between the two. Their aim is to help the NHS and the private sector, and most importantly, the patient.
Caring is at the heart of the NHS, but as it looks to save £20 billion over the next few years, it's turning more and more to the private healthcare sector, which includes the pharmaceutical and medical devices industries, to collaborate for mutual benefit. London on a hot summer's day. Professionals from the public and private healthcare industries are meeting to work on strategies to best help the patient and save the NHS money. They've been brought together by the independent healthcare network agency Visions4Health, who help to bridge the gap between the two, stripping back the jargon so they can facilitate the dialogue. Sabina Syed is the managing director. She has a clinical background and has worked in both worlds, private and NHS, so understands the needs of the stakeholders involved.
I truly believe if stakeholders in health collaborate for the beneficiary of the patient, actually that's a good thing.
Visions4Health brings everyone together through think tank style meetings and workshops, interpreting both parties' valuable expertise. Visions4Health uses a quality network of commissioners, providers and clinicians to help create the right strategy, the optimum solution and ensure effective implementation. Working as a translator between the two has already led to a greater understanding.
The partnership between the NHS and the private sector has changed dramatically over the last few years. It's far less us and them, but working together to gain productivity.
What does their pathway look like? Because it will be intertwined.
Visions4Health started a dialogue between ourselves and GSK, the pharmaceutical company, at our annual conference and exhibition, particularly around epilepsy and the wider implications of that condition for the patients, for the carers, and also for their families. So it's not just talking about the treatment.
An example of collaboration is Visions4Health using digital platforms to allow healthcare professionals from across the UK to share ideas, ask questions and try to solve problems. A team of NHS workers do the training, sparking ideas and finding common ground.
Visions4Health have got a really good attitude towards these forums, and they're very different in that unlike other commercial entities, they're not looking for kind of revenue opportunities. We're discussing the system in total. We're looking at the political agendas, looking at the kind of the social change and looking how we can best work with the NHS as a whole.
Private and public has a history of being wary of one another. Visions4Health builds trust.
I think commercial organisations have a variety of different interests at heart. I think they do want to work with patients and they want to see patient outcomes. There's no doubt about that. They obviously have different levels of commercial interests that they need. Whereas in the NHS, I think the dedication there is all about the patient-centric focus. Do I think that we have a cultural? Are we seeing eye to eye? I think a lot more. But I think that is still a playing field that we're working on.
Visions4Health work hard to find common ground to benefit all.
I think the future for the NHS is that it will have to partner and look at strategic relationships with corporate entities. I don't think the status quo can or is not possible to be sustainable.
Actually, there is a solution or a sweet spot that works for both the NHS and the private company in order to benefit patients. And it's at that point where we feel at Visions4Health we've done our job.